Hello friends, welcome back to Know Your Tooth videos. Here is the x-ray of a patient who had come for treatment of his lower left first molar, which required root canal treatment because of a large cavity. We can see in the x-ray that the patient's lower left second molar is not there. So when we asked the patient what had happened to his lower left second molar, he replied it was removed because it had grossly decayed. When asked why he didn't get the tooth replaced by a prosthesis after its removal, he told he didn't feel so. We can see in the x-ray, because the patient didn't get the extracted tooth replaced with the artificial tooth or a prosthesis after its removal, the third molar, which is the last molar, it has tilted to the space. Once the tooth tilts towards the adjacent empty space, there can be food lodgement and it can result in pockets and bone loss around the tooth. Even problems like sensitivity and root caries may start in the third molar. The patient also said that chewing food on his left side had become difficult now. If he had got the second molar replaced by a prosthesis, either a removable one or a fixed one or an implant, then he could have easily chewed food on the left side also. Now, because the third molar has tilted towards the empty space, there is no space for placement of implant, or placement of bridge has also become very difficult. This shows us that if you get a tooth extracted due to some reasons, it is better to replace it with a prosthesis to avoid future problems like this. On the right side of the x-ray, you can see his lower first molar was extracted, but he got it replaced with a fixed prosthesis, a bridge. Okay, but on the left side he neglected it and now he has problems chewing. So don't do this mistake. If you lose a tooth, try to get it replaced by a fixed prosthesis to avoid problems in future. Please like, share and subscribe Know Your Tooth videos for more information.